Hi, my name is Melinda Elamari, and today I'm going to introduce you to Healthmark's SafeGuard Dry Sterilization Wrap. SafeGuard Dry is a sterilization wrap designed for wet pack management. It's comprised of two bonded layers. The outer blue layer is SMS polypropylene, designed for barrier protection. The inner green layer is wetlaid, designed for moisture control. SafeGuard Dry is compatible with Steam and Ethylene Oxide sterilization. Here are some unique benefits of this sterilization wrap. Its dual layer construction is designed for moisture control and barrier protection. It reduces incidence of wet packs and re-sterilization. It provides higher throughput due to faster dry times. And the two bonded sheets comply with wrapping techniques per AAMI ST79 standards. So why are we concerned about wet packs? When a package is wet after sterilization, it can allow for the ingress of microorganisms and result in costly reprocessing delays. Some factors that can contribute to wet packs include equipment issues such as wet to dry steam ratio, improperly maintained steam traps, or clogged chamber drains. Wet packs can also be caused by human factors such as incorrect loading of the sterilizer, uneven distribution of metal mass, wrapping items that are wet, or failure to use absorbent material. For a more extensive list of possible causes, please refer to AAMI ST79. Improper wrapping technique is an additional factor that can lead to wet packs. That being said, let's demonstrate how to properly wrap a tray using SafeGuard Dry. Our first step is to choose the correct size wrap for the item that we will be wrapping. So we have our wrap, and we want to place the item in the center of the wrap. We're using the envelope fold technique, and we have our wrap at a diamond shape and our item in the center. We're going to take our first flap, and we are going to fold it over the top of our item. We want our flap to reach the back of the item without being tucked underneath. So never tuck underneath. Your flap should go down to the back and still have enough for a tab at the top. Now that we've got that, we want to move over to our side. Using our hand to still hold and control that, we want to put our middle finger at the top corner, and we want to push down with our pointer over here. Here the goal is to make a valley, not a mountain. So we want to pinch the sides and bring our side up to our middle finger. Now that we've got that, we're going to fold this over. And here you can see that our tray is going up at an angle. Again, we're using the envelope technique, which is the proper technique in this case. But we want to walk this out. So to give this tray the best protection and the most coverage, we want to keep our hand here, grab both layers, and we're going to control the pressure here with this hand while we slowly walk out our inner wrap layers. As we do that, you can see it lines up perfectly with the tray. We want to give a tab so that the operating room can properly open this in an aseptic manner. Again, on this side, we're going to do the same thing. Middle finger at the top corner, push down with our pointer, and we're going to bring our pinched fingers up to our middle finger. Fold this over. Again, controlling, we're going to walk this out. Making sure we're grabbing both layers. If you don't grab both layers, you're going to have a jumbled mess here, let me tell you. So now that we've got those walked out, and they're lining up perfectly, we want to then also create our tab. Again, when you're doing your flaps, you want to make sure that you're not like pulling it to line up. You want it to lay evenly and walk it out correctly. Up at the top, we're going to go to our under layer first. We're going to push down and we're going to pinch and make our valley at the top. Here, we're going to do the same thing. We're going to pinch and make our valley at the top with our top layer. Now that we've got that, we're going to bring these up to our body And here, we're gonna straighten out our corners a little bit. And again, we have the same concept happening. We're going at an angle. To give it the best protection, we're gonna reach under, grab both layers, and we're gonna walk this out to line up with the edge of our tray the best we can. It doesn't have to be absolutely perfect, but we want it to line up the best we can. Again, over here, doing the same thing, lining up and squaring off with the edges of our tray. Turn the tray around, and we wanna tuck underneath all of our flaps, still giving a tab for aseptic presentation in the operating room. All right, now that we've got that done, we're gonna move over to putting tape on our tray. Now the goal of the tape is to hold the wrap in place and to be an indicator that the tray has nobody's gone inside of it, right? It's still sterile as a sterile barrier. So we're gonna grab a piece of tape. So now we got our piece of tape. We want about 1 to 2 inches on the top, 1 to 2 inches going down the side. Again, same concept, 1 to 2 inches. Does not need to wrap all the way around. And then we want a piece going across the middle. This piece should be long enough to reach the other side, and you want it in the middle to prevent people from sticking items in the middle, tucking them in, and putting their hands in the middle there. So now that we've got that taped down, you can notice we're not mummifying our tray. We're using the least amount necessary, but we're providing the protection, and we have our outside chemical indicator. So here we have our wrap tray. Now let's talk about a few important things to keep in mind. First is that we do not have protruding sides where the wrap is sticking out. I like to refer to this as dog ears. Whatever you call it, we want to make sure our sides are tucked in so that the steam does not pool and we have wet tray possibilities. Next, let's talk about our tape. This tape is an outside indicator. It should not be used on the inside of our wrap to hold our flaps together. We have our bodies. You got to use your body to hold it down. Do not put tape and do not put it down and take it off. That compromises the integrity of our wrap. When labeling, you want to use an appropriate labeling tool, such as this marker here. We want to label on the tape of our wrapped item, never on the wrap itself. So we're going to write what the tray is. We're going to also put my initials and the date. Additionally, you should also have a load sticker on your tray. Last, we want to discuss why our tabs on these trays are so important and why do I keep reiterating to make sure you have a tab. These are used to make sure that the tray is presented aseptically in the operating room. So another key factor is to never tape down this tab. You don't want this to be taped down. So the reason for this tab is, as I'm in the operating room, I will pull this and it should break all of my tape and one swipe as such. I'm going to fold this over and I'm going to grab the tab here, fold this over, collect in my hand. If I'm holding this, this is how I would open it. Again, same method on that side. And then here I have an item to present sterilely. So tabs are extremely important. So there you have it. With proper wrapping technique and the use of SafeGuard Dry, you're in a great position to prevent wet packs. For more information, go to hmark.com or contact your local territory manager.